So I'm the Assistant Director of Patient Services at Anthony Nolan. And unlike the majority of the organisation that is very much focused on the donor and developing the register, my responsibility and that of my team is very much with the recipient of one of our transplants and their friends and family around them. So we support the person having the transplant. Okay. I'm the Assistant Director of the team, and I run the team with 2 senior managers. So the function of the team sits in 2 sort of separate areas. One is very much around our clinical work that we do, and that's lots of relationships with our transplant centres across the country, and I have a lead nurse that helps me with our clinical nurse specialists. So we fund full-time NHS nurses. By the end of this financial year, we'll have funded 9 full-time clinical nurse specialists, and they are dedicated post-transplant nurse specialists. We also, so myself and the lead nurse also look at developing what a perfect pathway would look like. So we're looking at the pre-transplant pathway, and we've done loads of work on the post-transplant pathway. And then this year I'm doing a little bit of work around the provision of supportive care or end-of-life care for patients that have had a transplant. So there's the clinical side of the patient services, and then there's the more sort of traditional information and support side. Yeah, it's really exciting. We've wanted to get something like this off the ground for a long time, and we know that our colleagues in the US have got an app that they use, and it didn't quite fit the bill for the UK population and the UK transplant. So we've come up with our own. We've actually modelled it on an app that's already out there in terms of managing another long-term condition, and it's going to be called Transplant Tracker, and we're launching it in October. And it's for patients that for whom a transplant is relevant. So it kind of takes them from day 0 through to the rest of their life. And it's in 3 main themes. So it looks at managing the clinical side of a long-term condition, so all of their medications and their appointments and their practical side of living life after a transplant. It then has a section around health and well-being, so their quality of life, their mood, and then it has a sort of like a back to a new normal way of life. So things like physical activity, managing fatigue. So it's really all-encompassing life after a transplant, about managing the complexity of what life looks like when you've had something like a stem cell transplant. So the bulk of our work at the moment is around patients that have had a transplant. In stem cell transplant, their patients are often quite well before they have a transplant, not always, but we then make them quite poorly to prepare them for a transplant, and then the complications, the medical and physical complications and psychological, tend to happen after. So if we go back to before transplant, we have, like I was saying, our online forum, we have podcasts that we're starting to touch upon that sort of preparatory phase of a transplant. And again, with Hayley, our lead nurse, we're going to be looking at what we call sort of like prehab or prehabilitation, so getting somebody ready to have a transplant, looking at what their information needs are, assessing whether somebody is at high risk of developing sort of psychological distress during a transplant, and trying to input some of those services at an earlier point. So there's work in the process at the moment for the pre-transplant bit. During a transplant, it's quite anticlimactic. Often when people have a transplant, it's essentially just having, a drip of cells, but it's very, it really signifies something very important. But in terms of the support we offer people, we obviously have our Anthony Nolan nurses who will touch base with patients that are in having their transplant and recovering immediately after. And we then have all of our online information that they can access. We've got specific guides such as coping in isolation. So when you have a stem cell transplant, you're often isolated in your room, in a room by yourself, often isolated from your family and from your friends. And that can be for a period of weeks, sometimes months, that you're in isolation. And that can cause a huge number of psychological complications and anxiety and depression. And so we've tried to put some resources together to try and help people cope with that phase of their transplant. And then post-transplant, we've got all the resources that we've talked about. We have our dedicated nurse specialists. We have these Anthony Nolan education events that we take around the country. We sort of have it somewhere in the region of a couple of our big transplant centres. We can get 50, 60 people at a time that come to those education days. And it's about preparing people for what life looks like after a transplant. They get to talk to some of the professionals that might be useful to them, such as physiotherapists or dietitians, benefits and welfare advice, return to work advice. We also have a dedicated return to work programme here at Anthony Nolan. We know from a report that Macmillan did recently and compared it with some of our own data that transplant recipients find it much trickier to get back to work than the sort of general cancer population, as it were. So we have got a really lovely collaborative relationship with a vocational rehab company, so people that specialise in getting people with medical problems and long-term conditions back to work, and that's something that's really important, and we launched that last year. And we also have our peer support service, so we hook patients up with one another to try and just give each other a bit of moral support, and often try and hook them up with someone that's a bit further down the road than them to encourage them and to reassure them that what they're going through is normal. So our post-transplant pathway is really good. I'm incredibly proud of the work we've done, particularly around the nurses. And what that's done is allow us to work with lots of other transplant centres and nurses that aren't necessarily funded by Anthony Nolan, but use ours as a way to sort of drive up the care of transplant patients across the country, regardless of whether there's an Anthony Nolan nurse there or not.